Alhamdulillah, wassalatu wassalam ala Rasulillah. Assalamu alaikum wa rahmatullahi wa barakatuh, everyone. Welcome to our final class of Save One, Save Humanity from our Rekak. It's conducted by some emergency physicians, myself, Nabil Abdul Rahim, and I have my colleagues here with me, Zishan Ghani, Noordeen, Vikas Ahmed, and also we have two more doctors today, Dr. Nabil and Dr. Naufal. Really pleased to have you all here once again. We'll start with the ayah that we always start with from Surah Al-Ma'idah, where Allah Azza wa Jal says, وَمَنْ أَحْيَاهَا فَكَأَنَّمَا أَحْيَا النَّاسَ جَمِيعًا. And whoever saves one life, it is as if he had saved mankind entirely. This is a very powerful ayah, and this is the crux of this whole course, that we are doing this so that we earn the pleasure of Allah by saving a person's life. Also, the hadith of the Prophet ﷺ, whoever alleviates the hardship of someone in distress, Allah will alleviate his hardship in the worldly life and the hereafter. A hadith from Sahih Muslim. So moving forward, this has been our course overview for the last few weeks. This is the 7th week, and we've completed basic life support, we completed basic trauma life support, and environmental emergencies and poisoning. Today is going to be the final class with some miscellaneous topics, the topics which were suggested by our participants that they wanted some more clarity on. So we've added those topics, and we'll also show a revision demo of our previous classes, inshallah. So today's objectives are going to be, the first topic will be on situational awareness, and then we'll have various topics like electric shock, stroke, heart attack, and seizures. And we'll go back to our demo sessions on basic life support and trauma life support. Some tips on COVID-19 and what do we do next from now on, and our resources, and a few words from our special guest. So throughout this course, please be patient and try to attend the whole session. There will be a mix of lectures and demo in between. So just be patient with us through the course. So I would like to start with situational awareness. This is a very important concept, and this is being utilized and applied in various different fields in today's world. And so in that manner, obviously, in the medical sciences, this is a very important thing, where having an awareness of your situation is really important when it comes to saving someone's life, to saving someone's limb, to saving someone's heart, to saving someone's brain. Okay, all of that is really important. The more time you lose, the more time you waste, or the less the awareness you have of the situation, the greater the loss, either for yourself or someone else. And so this intelligence, okay, to have an awareness of the situation is very important, and it makes you different from others and gives you an edge over others when it comes to saving someone's life. For example, look at this picture. It's a very common thing where you see someone injured or someone who needs an help. There are the majority of the people walk by, okay, and don't think they can do anything, and they just keep carrying on with their life, okay. And all of this has great impacts, okay, on the society at large. And we as Muslims, just as the verses we went over from the Quran and the Hadith, if we step forward as regular Muslims to actually come forward and help anyone and everyone, any life, okay, in general, could be a plant, could be an animal, could be a human being, anyone, okay, you come forward to help a living soul, okay, that is seen as a big thing, okay, and that in itself is a dawah, that in itself is a great act, okay, which will be looked in a positive note. There are a few real life stories, okay, of how people have actually helped others and have saved lives. There are plenty, okay, I can go on and on and on about plenty of stories just to inspire you, to show you that how many are the stories where people have actually had that good situational awareness and have stepped forward and done something. These slides will be shared, inshallah, and then I have put the link below, where this is from the American Heart Association, where they've actually posted loads of hundreds of stories of how people have saved children are saved, babies were saved, various people were saved. Okay, so there are multiple stories. I don't want to go on one by one, but I put the link here so that you can actually go and read on your own time and see how people have saved others' life, and it could be an inspiration to you. We've spoken about this previously about the Good Sam app. The reason I put this slide again is to give an example of this neurosurgeon, Mark, and there was this programmer called Ali, and they got together to make this app, which is currently saving thousands of lives all over the world. Okay, from Europe, Australia, and Brazil, and all of the different parts of the world, this app has been used. Okay, and we spoke about this app in one of our previous classes. I spoke to Mark, one few months ago, and I was asking him, I was telling him about, what is, like, I'm from India, and I was telling him that how well can we use this in India, and he was giving me a few suggestions, and we were discussing about that. I asked him on how you exactly came to this app, and why did you choose to make an app like this, which is completely free. If you know, this app is completely a free app. Okay, it's not funded by anyone. They've been doing this in their own accord, and with their own resources. So their inspiration was Mark, as a neurosurgeon, could not, he was trying to see back how many people are dying of head injury and cardiac arrest when they come to the hospital. And he was saying that if they were intervened on spot, on a street, at home, their chances of survival were much more better. And he has himself, as a surgeon, seen this over many years. So he wanted to bring out a solution for that. Okay, and they ended up making this app. Now, in your situation, okay, you as a general public, you might see in your own society, in your own, street, in your own household, okay, what is that you can do to, what you can do to sort of bring a solution to the issues? Like someone is having a stroke, someone is having a heart attack, someone is having an illness. What are the best ways that you can make their chances of survival better, that you have to find for in your own situation? It's just a slide to give you an inspiration to innovate in this worldly things. Okay, through an app, through a helpline number, to create probably a small funding, okay, resource, whatever it is. Okay, it's completely up to you, but you have to create your own solutions for your own problems in your area. And finally, obviously, we talked about this as well. It is a chain process. Okay, it's a chain of survival where you started off early CPR, early shocking, and then the person goes to the hospital. It all has to be a link. So everything has to fall in its place. Then alone, it becomes a chain of survival. So this picture has been put again for a reminder that as a society, it starts from you as an individual trying to help. Then it passes on to other people trying to, it's the teamwork. Then the ambulance has to arrive on time. That has to be taken, the person has to be taken to hospital on the right time. And then the hospital has to work quickly to make sure things get better. And if all of this fall in its right place, then a life is saved, or a person is, person becomes better. So now I'll pass on to our topics today. I'll pass on the mic to Dr. Nudin. He will talk to us about electric shock, a little bit about it, not in details, just because again, this was again a topic that was chosen by the participants, and they wanted more clarity on this. So I welcome Dr. Nudin.
Assalamu alaikum warahmatullahi wabarakatuh. Can you hear me, Nabil?
Walaikum assalam warahmatullah. Yes, I can hear you. Yeah, go on.
Yeah, okay. Can you see my screen as well? Yeah,
I can see your screen. It's clear. Yeah.
Okay. So, so about electric shock, I think we have discussed briefly about electric shock and burns occurring because of electric shock in our previous classes, in which the first aid is basically, as we mentioned earlier, ensuring the scene is safe, cooling the burns, remove if there are any jewelries attached to a site of burns, protecting the burns with cling film, and giving painkillers. So in this, we will talk about electric shock in short, about what to do when someone collapses after sustaining an electric shock. So electric shock as mentioned, it depends upon the amount of current that passes through the body and the amount of, the type of injury that occurs. So typically it can vary from less than 1 milliamperes to even to up to thousands of milliamperes, even up to millions as well. So when someone sustains an electric shock, and if the amount of current that passes through the body is less than 1 milliamperes, or let's say if it's like less than 10 milliamperes, normally what they tend to have is a tingling sensation, and they often tend to withdraw the hand immediately. So if it goes about 20 milliamperes or even up to 50 milliamperes, there are chances that they can have breathing difficulty, and they can have a sensation that something is trying to pull them towards it. And if it goes above 100 milliamperes, there are chances that it can cause irregular heartbeat and can go in for collapse, and they can collapse and have a cardiac arrest as well. So what to do when someone collapses after an electric shock? So the first thing is turn off the power source at the mains if possible. And if that is not possible, try to protect yourself by standing on a dry insulated material, like either on books or like rubber material or on newspapers, which does not conduct electricity. And if possible, try to, as shown in the picture, try to push away the victim away from the power source by using a non-conductive item like a broomstick or a wooden chair or something like that. Then once that's been done, the next thing is check for response. It's your DRS ABCD. Check for response. If there's not much of response, call for help and then go back to your ABCD. Check for airway and see if they are breathing and if there is a pulse. If there is no pulse, start your CPR, which is the ratio of 30:2 in adults. If there's a response and if there is breathing and there's a good pulse, try not to move the victim. Try to call the ambulance and take them to the hospital. So yeah, that's about electric shock. And lightning is like another form of electric shock, with the only difference is the amount of current that passes through the body is more than like millions. It can be up to 30 million volts as well sometimes. So the majority of the people after an indirect lightning shock has a good survival rate, and the amount of injuries can vary. Sometimes they can have like a severe form of headache. Some they can have seizures, or sometimes they can have vomiting, dizziness, and sometimes it can cause a cataract as well, and causing leading on to blindness. Sometimes because of the sound produced by the lightning, it can perforate or it can injure your eardrum and can cause deafness as well. And sometimes because of lightning, there can be severe muscle contraction causing severe muscle injury and can have fractures as well at sometimes. These are all the immediate form of injuries that can occur secondary to a lightning injury, whereas a delayed ones, they can have long-term effects like deficit in their memory. They can have chronic generalized body ache. There can be some form of personality changes or some form of stress disorder secondary to this form of injuries. So what to do when, or how to prevent a lightning strike? So what you can do is, when you're outdoors, try to stay away from a tall tree or something, because what happens is, if you're standing under a tall tree, the lightning tends to get attracted to the tallest tip of a tree, and it passes through the tree, and if you're standing under the tree, it can get connected to you as well. So try to stay away from the tree, and that is one thing. Another one is, if you are in a car, typically the car acts like an insulating material. It acts like a Faraday's cage, so the lightning can pass through the car without getting connected to you and can get grounded as well. And if you see a lightning striking somewhere, or if you can hear the sound, what you can do is just crouch down. So that's the best thing you can do. So the reason for crouching down is the more nearer you are to the ground, the less likely you are to be struck by a lightning. And when you sit to the ground, try to cover your ears as well, because of the sound that can, as I said, it can injure your eardrum and can cause perforation and cause deafness as well. So even while sitting down, try to sit on your forefoot, but not on your heels, and try to put both your heels together. The reason is, sometimes lightning can strike the ground and can pass through your body through the ground as well. So if you crouch down and put both your heels together, the lightning can pass through one foot, and there are chances that it can get grounded through the other foot rather than passing through your body. So that is one thing which you can do to avoid lightning strikes. So stroke is one another topic which most of you people asked about. I think most of you know what a stroke is. It is a form of brain damage, which can be secondary to two things. One, it can be a clot that can occur in your brain because of various reasons. Or the other possibility is it can be because of a bleed in or rupture of one of your blood vessel, and can have a significant bleed in your brain. So almost 85% of the strokes are due to blockage in the brain because of various reasons, either due to high cholesterol, high blood pressure, or due to diabetes, or due to an irregular heartbeat that can dislodge a clot and then affect your brain. So, so brain is not like any other organ. So let's say if your lung stops breathing, you can put them on a ventilator and be on a ventilator for a long time. Or let's say if your kidney fails, they can be on a long-term dialysis. But brain is not like that. Brain, once if damage occurs, it is irreversible. So when someone sustains a stroke, or if someone sustains an injury to the brain cells, typically, that's mentioned, 2 million brain cells die every minute. So time is more critical. So the earliest you take them to hospital, and if it's a stroke, they can be treated at the earliest to prevent permanent brain damage. So this is a common mnemonic which is used to detect if there is any form or symptoms of stroke, which is a B fast. B is balance, sudden onset of loss in balance while walking, or if they feel like swaying to one side, or if they're having dizziness, and headache. Headache is typically like the worst headache you ever had, or you wake up from a headache, and if it's not responding to any form of pain medication which you take, and it's like the worst ever headache you ever had, you need to go to the hospital to get yourself checked, because that can be a sign of stroke as well. Then is eyes. There can be blurred vision or sudden onset of loss of vision, either to one or both side of your eyes. That can be a sign of stroke. That can be a block in one of the blood vessel, either behind at the back of your eye, or it can be in the brain as well, which is supplying the eye. So that is another one. Third one is F, which is for face, like drooping of face to one side, or drooling of saliva, or when you try to eat something, or when you try to drink something, and if you're not able to hold it in your cheeks and it starts drooling to one side, that can be a sign of stroke. Next is arms, which is A. Arms is like weakness of either one arm, or like on the same side, one arm and one leg. When you try to grab something, or when you try to walk or gives way, that can be a sign of stroke. Third is, and the last one is speech disturbance. Speech disturbance is typically slurring of speech, which can be an early sign of stroke as well. So if you have any one of these symptoms, make sure you take them to the hospital within a time period, which is between first 3 to 4.5 hours. I would say first 3 hours is ideal, because by the time you go to hospital, they do a CT scan of your brain and see if it's a bleed or a clot in your brain, and that can be managed with certain medication, and you can highly prevent permanent brain damage. So make sure you take them to the hospital where a CT scan is available, and get tested yourself. So that's it about stroke from my side. And stroke cannot be managed at home. If you have any of the symptoms, make sure you take the victim to the hospital and get checked. And that's it from my side, Nabil. Jazakallah.
Jazakallah khair, Dr. Nordin. It was a really wonderful talk. And
let me stop the screen sharing just a minute.
Yeah, I'll now call on Dr. Zishan to start off our talk on heart attack. Again, one of the topics which many people wanted to really know about. Finished lightning, we finished stroke, and probably I'll hand the mic to Dr. Zishan to talk on heart attack.
Bismillahirrahmanirrahim. Assalamu alaikum, Nabil.
Walaikum assalam
Can you tell
warahmatullah.
me what screen you can see, Nabil? Is it the presentation or is it the other one?
No, I'm not able to see your presentation. Are you trying to share?
Yeah.
Uh,
Okay.
What do you see now?
I can see your presentation, Zishan, like not the full screen one.
Okay. Let me get that. Sorry. Yeah. What about now?
Yeah, now I can see the full screen. Yeah.
Okay.
So I have two topics today that I need to talk about. One is seizures. The other one is about heart attack. So it's a big topic, but we have tried to shorten it as much as possible. So seizures. Everyone has heard about seizures. You know, you've seen seizures at some point of life. Uh, Kids or anyone else. Okay. So what are seizures? Basically, seizures, or in simple English, we call them fits. All right. Or some people might say epilepsy, where epilepsy is actually a disease. So seizures are basically when an abnormal electrical activity happens in the body, in the brain. So your brain works by passing small electrical impulses to your hands and legs and muscles, and that's how your body moves. But when there's an abnormal level of electrical activity in the brain, there will be a seizure. Okay. So what happens is usually due to this imbalance between the impulses, there will be so much electricity going on, small bursts of electricity, that all your muscles and your body parts will start moving continuously. That's called a seizure. Okay. So what are the common reasons that this happens? In newborns, usually it happens if there have been some problem during birth, lack of oxygen, or some problem inside while development. In children is what most of the parents will see. The most common reason, as I've highlighted, is you'll see it in what do you call that? You'll see it in kids having fever and infections. That is called a febrile seizure. If any child's temperature goes very high, they because their body is so sensitive, they can have a seizure. Okay, and parents get very scared, and because they've never seen it before. Okay, as you get older, things that will cause a seizure is having an injury to your head. Maybe some people have a brain tumor, some people have a stroke. These things can cause a seizure. Even big infection can also cause seizure. Okay, what are the signs and symptoms of a seizure? The most common is uh, the person might look confused, he might be staring vacantly, or as you go older, they'll be like, I sense something is happening, something is about to happen. These things they can sense. Some emotions, like tingling sensations, tickling sensations they get, or they fall down. And the biggest stage is you'll see the entire body starting to shake. All right. This is what happens in the what do you call that? How seizure starts from a minor aspect to the how the big aspect of body shaking all that. And you would have seen kids with high fever. They go through this phase where they're just staring and they're not really responding, and then they have a seizure. Okay. So what should you do now? If it's your child or if it is anyone else, first thing is keep the child or the person in recovery position. Okay. Take away their glasses. Take away their uh, put a pillow under the head. Take away all other things and make them lie down and make them sleep on the left side. Okay, they will be moving, they will be shaking. Don't get scared. Please don't put key, don't rub their hands, don't stop their body parts. You cannot stop it. Okay, it will stop by itself. Okay, don't do anything, leave it on its own, it will stop on its own. Okay, people put a key, metal object, and all the other things. These are all things that people develop, but these things don't work. All right, the most important thing is the timing of the seizure. It's very important. A lot of people forget. Know how long the seizure was. 2 minutes, 3 minutes. It feels like it's going on forever, but it's actually most seizures happen only for a few minutes. Okay. If your seizure goes on for more than 5 minutes, you have to go to the hospital. You have to call the ambulance. Do not wait. Okay. Again, in a nutshell, don't panic. Turn on the side. Keep a track of the time, how long it's going on. Stay with the child. Don't restrain them. Put something soft under the head. Don't put anything in the mouth, please. Don't put in water or anything until they get up and they are fine. No, don't give anything. Let them lie down on the side. Let the seizure finish off by itself. It will stop by itself. Okay. Some people who know what medicine they can give. If you know that your child or a person has epilepsy, usually they give a spray. It's called a midazolam spray. All right. So you give this spray in the nose once or twice, and usually that acts like a sedation. It brings down the seizure activity of the body. Okay. You can give this in the spray. Sometimes some people may even have a suppository. Uh, where they give a small medicine from the backside, from the bum area. This is for children, especially. This also works. How will it affect your long term? Uh, if you've had a seizure, if you had epilepsy, you should have a neurologist look at you and give clearance before you start driving, swim alone, go do activities like climbing or trekking and all those things. You need to have clearance from neurologists. Please don't drive. If you have an accident, it will be dangerous for the people. If you swim alone, you can drown. If you're doing some high risk activities, trekking or anything like that, you might fall down and hurt yourself. Again, if a woman who has seizures or epilepsy, she's pregnant, she needs to fix her dosage with the neurologist and doctor or obstetrician to know about the pregnancy, because it can affect the pregnancy as well. Okay. Finally, yes, seizures, again, seizures will last a few minutes. They will stop in 2 to 5 minutes. Don't panic. Don't do anything silly. Put the patient down. Be calm. Count your time. If you have the medicine, give the nasal spray or give the suppository. Call for help if it's going on for more than 5 minutes, or if the patient has injured themselves or bleeding. If you don't know what needs to be done, then you can call for help as well. Remember, seizure happens once to some people. Febrile seizure, seizure fever happens to kids as well when the temperature is very high. Once the temperature goes on, it will stop. Epilepsy is a disease where they'll have lifelong seizures. Okay, epilepsy and seizure are not the same thing. Epilepsy is a disease where you need tablets for lifelong or many years. Yeah, so that is about seizures. So the next topic is heart attack. Okay, everyone has heard of it. Everyone's scared of it. The common people call it heart attack. In medical terms, in hospitals, we call it MI, myocardial infarction, or we call it acute coronary syndrome or ACS. So basically, what happens is your heart is a muscle. It's a big muscle that keeps pumping constantly, and that muscle needs energy. That energy comes from blood supply. All right. So you have blood arteries that go to the heart muscle and they supply blood. If those arteries get blocked, your muscles don't get enough energy and they may start dying. So blocked artery can cause death of your heart muscles, and that will not cause it to pump properly. All right. So this is what, when they do an angiograph, this is what they can see your arteries. They can see small blocks. All right. When you see these blocks, 50%, 60%, 90%, you know how much dangerous it is to heart. 100% block, definitely no more blood supply. Your heart muscles can die and it can cause a heart attack. All right. This is how it looks like in real life. You see all this white and red, all that is normal heart. But you see all this black area here, that is what a dead part of the heart looks like. This part will not pump properly. This part is what will cause heart attack. All right. Um, yes, where all do you get fats in your arteries? You get in your vessels in all your arteries. Your arteries have go along from your heart till every part of your body. The biggest areas are in the heart, in the thighs as well. So when you get fat accumulation there, it becomes very thick. It's called a plaque. This plaque will not allow blood to flow properly. If you zoom in closer, look at this. This is how a normal artery looks like. Blood flows through very nicely and clearly, like how we have pipes in a home, drainage pipes. But the moment you have all the fat and all the cholesterol and high cholesterol and all those things, fat getting accumulated, See, there's not enough blood flow. There's only this much that blood will flow, and that will cause damage to the heart. All of this area. This is what, and this can happen anywhere in the heart, and that causes death of the heart muscles. All right. What symptoms will you have? Most common, what we all seen, chest discomfort. It'll be like a squeezing sensation that comes in the heart, tight sensation in the left side, and it does not go away. Sometimes you'll get sensations in your neck, in your mouth, in your stomach, like acidity. Sometimes you'll get, but this gets worse and worse and worse. All right. Sometimes you'll not be able to breathe. Sometimes they'll feel that they're sweating or they feel lightheadedness. I have seen a man who came with shoulder pain. We thought it was shoulder pain because he said, I came in the bus. I was holding the bus, the handle. So we thought it was shoulder pain. But then eventually the shoulder was okay. When we did an ECG, we found out he had a heart attack. We immediately send him for treatment. Imagine, it can be as vague as that. Okay. Sometimes you might not have any of these symptoms at all. Still, you might have heart attack. So remember, if there's something uneasy, it's always good to have an ECG, no harm in it. Do an ECG, it's okay. If you have diabetes or nerve damage where the sensation becomes poor with age, even they will not have many of these symptoms. Okay. Remember, main point is heart attack gets worse with delay. It will not recover by itself. You need to go to the hospital, have some treatment to clear out the arteries. Okay. If you are alone, what will you do? Call for ambulance if you have a heart attack. Sit down, stay calm, call someone to help you. If you have 300 milligrams of aspirin, take that. Usually that helps in clearing out the blood. Okay. And wait for the ambulance to come, or if not possible, please go to the hospital as soon as possible. Don't wait, it will only get worse. In the hospital, usually they do two things if you have a heart attack. One is giving a stent. Okay, this is what they call PCI. They'll talk about stent and people don't know. Simple thing is the stent is a small wire-like thing. It goes inside the heart. It opens up the blood flow. As soon as the blood flow opens up, there's more blood going to your heart muscles, and your heart muscle revives and it becomes strong. The other thing is, if you can't do this because it's too expensive, some people go for clot dissolving medications. Okay. These medications basically, if you can see the picture on the left, they go into the clot area and they start dissolving that area and this opens up. You see that nice pictures with the green medicines. It doesn't look like that in real life, but this is just to show you. All right. So this goes up and it opens up the block. This is not as effective as the stent. This stent is much better than this one. But if some people who are poor in faraway places where they cannot reach big hospitals, they always give the medicine which dissolves the block and the fat and opens up the artery. Okay. If you're an option between this and this, I would say go for this one. Okay. For the stent. Again, in summary, sorry, not summary, the worst case scenario if someone has a heart attack is cardiac arrest. This is what we have been talking about. If they have a cardiac arrest, the heart will stop working, they will collapse. If that happens, follow the DRS ABC protocol, airway, breathing, circulation. Are they responsive or not? Call for help. Look for the airway. Look if they're breathing or not. Check for the pulse. If there's no pulse, start CPR. Give 30 compressions, 2 breaths. Until the pulse comes back or they wake up, you put them in recovery position or an ambulance comes. Yeah. So this is a quick summary. It's a very big topic. This is what I could squeeze in all of this in 15 minutes. This is a reference that we'll be giving out to you. Please go through this pages. This is for the layman people. This is very, very helpful. Go through this in your free time, read this, share it to people, and inshallah it will be beneficial for you. Yep. Back to you, Nabil.
Jazakallah khair, Dr. Zishan. Really very resourceful and useful talk. Inshallah, we'll be answering some questions anyways. If you have any questions regarding this, put them in the chat box and we'll be collecting them one by one, inshallah. So regarding the seizures, recovery position, we will come back to it, Dr. Zishan. When we're doing the demo, we will show them, inshallah. Is that all right?
Yeah, okay, sure, no problem.
All right, okay. Because I don't want to, just let's keep this moving. So the next topic is going to be on COVID-19. Again, something which people wanted to know. about a few things. We've had a separate talk on this. We had a separate doc talk on this, Let's Talk COVID, a couple of months ago. And I've put the link on the slide here. It's uploaded in SoundCloud. You can always access it, and lots of people have seen it. So if those who have not seen it, you can always access that and have a look who want to know more about COVID in detail. But I will not be going into the details of it, in every bit of it. Just few things. To start off with, okay, the first thing you need to remember about COVID is stop this infodemic. Okay, we need to infodemic, like pandemic, is stop spreading information which are not true. And we saw a big surge. Okay, I think the whole world saw a big surge of information, false information being spread across various social media platforms. So you can see this picture. Okay, the moment you start asking these questions, you can stop doing that. Okay, and you'll stop passing on a wrong information to others. And I think it has come down considerably, much better than what it was before. But in the peak of the first wave, there was a lot of misinformation being spread around. And there are still groups who are, there are extreme people who don't believe that there is anything called coronavirus. They think that there is nothing called a coronavirus. It's just a false thing made up by government. So there are still people like that. But however, we are people who are smarter than that, who can understand that it's not, all those are false allegations, false news. Okay, we should stop it. So few pointers. The main thing I want to bring down to it is pointers. I'm sure all of you know what COVID-19 is. I put that first line because just to make sure that everybody understands this is caused by a virus, not a bacteria, and they're spread by droplets. Remember, the droplets, or the from your nose, from your mouth, they are the primary source of the spread of the virus, because this virus stays in your nasal cavity, in your throat, okay, and harbors in your lungs. Basically, that's the route, not through your blood, not through the other means, okay, unlikely. Main thing for people at home, okay, over the last few months, I've spoken to various different people who've tried to contact us regarding what to do with their parents. They have COVID positive, okay, but they're unable to breathe, or they're okay with saturations, what to do, what not to do. A lot of questions. My basic thing is, if you can, as you see on the right side, if you can get a pulse oximeter, and that will be really a good investment, I would say, okay, because if you suspect there are vulnerable people in your home, or elderly parents or relatives who are susceptible for COVID, this is a really good investment. Okay, keep a pulse oximeter at home. You get it for a cheap cost or sort of reasonable cost online. And if your normal saturations are 94 and above, okay. So if your saturations fall below that, let's say 92, okay, 94, less than 94 is alarming, but still not as bad as 92. So 92 and below, okay, if the saturations remain like that for a long time, okay, and they're not picking up, then that's the time you need to go to the hospital, okay, because they need oxygen, okay. They may not be even realizing that, because COVID is such a condition where the oxygen levels fall and you don't realize it. The other thing, if the COVID-19 positive person has a chest pain, okay, or collapses, then please go to the hospital. I'm not going into the details of why that happens, okay, but remember that's a bad sign, okay. If someone having chest pain or a collapse with the COVID-19, go to the hospital. The other thing being, the main reason for hospital admission should be for oxygen therapy, because you need oxygen. You don't get that oxygen at home, okay. There are few people who can afford oxygen at home, okay, but majority cannot. So if you need oxygen, you need to go to hospital. And also the other reason, some people are very sick and they're very unwell, in the sense they can't eat or drink. If they reach that stage, they need fluids to be put through their veins. For that, you need hospital. Other than these reasons, every other person who's got a COVID and are okay, if they don't really need oxygen or fluids, can stay at home, ideally, okay, generally. So you don't have to rush to hospital every single time somebody has a COVID. And here, there are so many people that we send back home every day. I see in the hospital, okay, Dr. Zishan sees, Dr. Nodin sees, Dr. Vikas also sees in India. And we don't treat everyone in the hospital. Everybody who's COVID does not need to come to hospital. Okay, it's a waste of admission. It's a waste of your money and a waste of your time and waste of everybody's time in the hospital. Okay, so you can manage it at home as long as you don't require oxygen or fluids. All right. As you can see on the graph here, your chance of death is only very high in someone very older in age, 70 above. Most of them, majority of the patients get through this, okay, without much harm. And the second doubt from the people was about what's happening in the hospital. Okay, So I've just summarized these are the main things because this is primarily a pulmonary issue. This is basically a lung issue, okay, which is the first one that's affected. So most of them need oxygen. So we give, if they need oxygen, they come into hospital. That's the first one, first picture. Second picture, if this oxygen is not sufficient, we need to give air from outside. They're not able to breathe enough. We put a mask on the face. This is a mask on the face, which is giving them air. It's called non-invasive ventilation. Only if they fail through this, even despite this, they're not able to get enough oxygen. Okay, that's when we need to put someone on tube. Okay, we need to intubate them. This is the final stage. People get scared when we talk about the center picture, the center one. When we tell them that we are going to put them on non-invasive ventilation, we're going to put a mask that's going to give them air. This is not the same as this. Okay, this is a more serious scenario. This is not. And this is what everybody's inclining towards now. We're trying to keep the patients maximum on the center picture, okay, on a machine that can give them air and avoid this. So if they tell you that, shall we put them on non-invasive ventilation, or they're giving their information, don't get worried that this is, they're going to get intubated. They're going to put a tube inside. And there are various myths around COVID. I'm not going to details. I got this from the WHO site. I put the link here again. If you click on this website, the link, you'll go into this page where it gives you a lot of information on what is true, what is not true about COVID. Okay, how people talk about vitamin D or vitamins. People talk about hydroxychloroquine. All of these things, what to do, what not to do, what to take, what not to take. All the information is available in this website. I won't go into details of it because this is not all about that. Great. So now we'll go to a demo. Okay, Dr. Vikas, are you ready?
Yeah. Maybe.
Okay. All right. Walaikum assalam. So just before we start that, we're going over basic life support now. This is from one of our first class. Okay, there's one slide from the first class. We all talked about this, so many times by now. I hope all of you are very clear about it. DRS ABCD. You check for danger response. You send for help, airway, breathing, circulation, and defibrillation. Okay. So great. Let's start with the video then. Dr. Vikas, you can come online now. I'm going to stop sharing.
Okay.
Yep.
Yeah, Nabil.
Great.
Yeah.
I hope everybody's able to see it now. Good. I think it should be fine. No issues from the messages. Right. Okay. So let's go over this. This is not going to be a detailed one. We're just going to run over a scenario where you've come across let's say a 35-year-old, let's say the majority of the participants here are women. Let's say one of your close friend, she's 35, she's collapsed suddenly, okay, in front of you, and you're not really sure what's happening. So how would you approach the scene? Okay. And let's say this was a kitchen fire, just to make sure that let's make it a scenario. And let's say she was working in the kitchen, there's a lot of fire, and now the fire is getting off, but then she's collapsed. So how would you start the scenario? The first thing would be check for danger. Okay, D, R, S, A, B, C, D. So D is danger. Make sure you don't put yourself in trouble first by getting in contact with oil, fire, other things. Make sure the scene is safe. Okay, and then your next step is response. Go close to the person and check for response.
Hey, are you okay?
All right.
Hey, wake up. Are you okay?
So if there is no response, then shout for help.
Can you call the ambulance? Can you call the ambulance and get an AED or something?
Okay. And then once you do that, DRS, then comes A, and A, B, C, D. So if we, at the same time, what you need to do is a head tilt and chin lift to open the airway. Okay, so that's how we do a head tilt chin lift. That's the first thing you need to do to make sure that the airway is open so that the air goes in. Okay, head tilt, chin lift, and keep the mouth open a little bit, and that way the air goes in. Okay, at the same time, check for pulse. So the place for checking pulse is going to be on the side of the neck. Okay, you can use 3 fingers. You can keep on the side of the neck. From the center, come to the side of the neck. Press it against the center of the neck. Once you press, you can keep it there for a few seconds, 5 seconds, but not more than 10 seconds. Not more than 10 seconds. Once you're not able to feel a pulse, then you need to start CPR immediately. Okay. So for demonstration purposes, we'll move on to a mannequin and we'll give 30 compressions.
9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25.
Okay, 30 compressions. Yep. Head tilt, chin lift, pinch the nose and give 2 breaths. Yep. Okay, then 30 compressions. Perfect. So we keep doing this 30 compressions, 2 breaths, 30 compressions, 2 breaths till help arrives, till the ambulance crew arrives, or till somebody gets an AED machine. Once the AED machine is with us, we'll attach the pads on the person and let the machine tell you what to do next. If the machine tells shock, then step away, let the person get shocked, then continue CPR. If the machine says shock not advised, but continue CPR, then you continue CPR. You're going to keep doing this 32, 32, 32 for 2 minutes and then check the pulse again. No pulse, again 32, 32. And this goes on and on till you get the help. All right. On details of this basic life support has we've dealt in detail about this in the first 2 classes. So for those who have not listened or listening for the first time, can always go back to that and listen, inshallah. So great. So I'll go back to my screen and yep. So the next one will be choking. Choking, as we discussed, on adults, it's going to be the Heimlich's maneuver. We have to give strong abdominal thrusts to get a foreign body out if someone's choking on an object. And for children, it's going to be back slabs. Children, I mean, they're infants, okay, less than 1 year. They need to hit on the back and push on the front of the chest. So once Dr. Vikas is ready, we can start with this session. Okay.
Hello?
Are you ready, Vikas? Yeah.
Yeah.
Okay. So come on, let's show a demo on this. Great. I hope everybody's able to see. If you're not able to see, please put in the chat. At the end, we can pick it up. Great. So this is called the universal sign of choking. So you see how Dr. Naufal is holding the throat. You can see if someone has been eating something with you, let's say in a restaurant or at home, and they've taken a piece of a food or something that goes into the airway, they can't really, spit it out. They're suffering with it. In that case, what you really need to be doing is ask them to cough. If they're not able to cough and they're suffering like this, you immediately
Cough.
Okay. If he's not able to, and then you go on the back and you do the Heimlich's maneuver.
Are you okay? Are you okay?
Okay. So when you give few thrusts like that in the abdomen, that forces the air to come out through the the block passage and then pushes the object out. And this is a very, very useful procedure to save a lot of people, okay, who choke on things. And there are plenty of videos we showed as well of people in real life, people have been doing that. So that's for an adult. For a child, small child, let's say 10-year-old, you'll still be doing the same Heimlich's maneuver. But for a baby, let's say a small baby, 1 year old or so, you can't do the same procedure because their body is soft and the abdomen is soft. We can't really do that much, can't give that much of force. So instead, what we do is, we would give thrust in the front and the back. So how, like Dr. Vikas is demonstrating, I'll let him demonstrate and show.
Okay.
Yeah. Check for the mouth.
So
There isn't
open the
anything.
mouth with the 2 fingers.
Yeah. Yeah.
Okay. I'm going to stabilize the head with my hand. My whole of my hand will be where the baby will be sitting, and a bit soft landing. I'll use my leg as a support, and I'll give a strong thrust back between the shoulder blades. So there will be a strong thrust of 5. I give 5 in the back, and then I hold the head and the neck, the other hand, and then rotate. And then similarly, I'll be giving between the nipples. So 5 thrust. 1, 2, 3, 4, 5. And then I'll be checking if there anything in the mouth. If I'm able to see anything obvious, I'll be taking it out. If not, there's no response, and I feel that the object is inside the mouth, and I'll be repeating the same by holding the head, opening the mouth, and keeping the the body of the baby on the arm in the same position. I'll be repeating the same shoulder thrust, and I'll be doing the same abdomen thrust, and I'll be still looking, is there any object? If I find anything, I'll be taking it out, and if I see the baby is crying, and I'll be happy that the object is out, and put him on the recovery position.
Perfect. Very good.
Yeah, is that fine, Nabil?
That's perfect. Yeah. So this is how we save a choking baby. And again, the details of the choking baby has been detailed in detail. We've discussed in detail in the past. Dr. Zishan has taken a separate class on that, and all those videos are available. And the recordings and the PPT are available. So great. Now I'll switch again to my screen, okay, for our final demo topic. So the last topic is going to be basic trauma life support. Okay, and that was one of our class. And again, the same principles applied. Okay, DRS ABCD, danger, response, short for help. The only difference here is airway is going to be with C-spine protection, then breathing, then circulation with bleeding control. And then D is disability, that's head injury. And then you expose and explore. So the main point here was about the airway with C-spine immobilization. We do not do a head tilt chin lift. Okay, we do not do head tilt chin lift. We do a jaw thrust on a person who's not breathing, who's had an accident. A person who's had an accident, we do not do head tilt chin lift, we do jaw thrust. We do not carry them without supporting the head. So we have to immobilize the neck and do a jaw thrust. So when Dr. Vikas is ready, we'll go on to this. So I'm just waiting for your call, Dr. Vikas. Once you're ready, we will start the demo on this, inshallah. I'll let them arrange. And
Yeah, Nabil, can you hear me?
yeah, I'll stop sharing now. Yeah.
Yeah.
Great. So fine. So let's come to an accident scenario. Okay. We used previously the same scenario where a person from a motorbike has fallen down. Okay, and you've been passing by the same side of the road. You've seen that he's just fallen off the bike. There is some bleeding from the head, but he's fallen down, and you approach. So how do you approach? The bike has fallen, it's broken. Okay, the person is lying next to him, next to the bike. And how do you approach the scenario? So starting with D, check for danger first. Make sure there isn't any obvious petrol leak or any fuel or burning things around the person, so that you don't harm yourself first. And then first thing you need to do is to approach the person and hold the head. Okay. And we explained why we need to stabilize the head first, the neck first.
Hey, are you okay? Hey, can you, sir? Are you okay? So, what's your name, sir? Are you okay?
It's not much of response. He's breathing, okay, but the breathing is very minimal. He's not able to breathe much, okay. But you're holding the neck. That's You're holding the neck in position because you don't want his neck to be flexed. And if he's broken his neck, that will make it worse. So that's why you're holding the neck in position. And if possible, if someone else is there with you, it'll be a good thing. They can come and support the neck while you do a jaw thrust if he's not breathing enough.
Yeah. I'm getting a help from another person, and I'll be doing the jaw thrust now.
Great. Okay.
Assuming that
Fine. Perfect. Yeah.
the other person
So
is
you can
holding the same
you can
hand.
continue with jaw thrust. Yeah. You can continue with jaw thrust. Yeah.
Yeah. Okay.
So a jaw
So
thrust
thrust.
is, you see the jaw, the lower jaw. Yeah. I'll let you explain. Yeah.
Okay. So I'm going to pull the jaw up so that he's able to move both of, or open the mouth a little bit so that he can breathe in and out. Can you see the
Yeah.
jaw went up?
Yeah. As you can see, in our face, only the lower jaw moves forward and backwards. Okay. So the lower jaw is lifted up, and Dr. Vikas has lifted the lower jaw. If you can show where in the angle of the mandible where you're doing it.
This is the angle. This is the angle. So here,
Yeah.
you're going to keep the hand,
Yeah.
fingers, and then support your thumb over the cheek, and then
Yeah.
pull it up.
You can see that he's pushing it up. See, the jaw opens up. In that way, you're not bending the neck or doing a head tilt and chin lift. You're avoiding head tilt, chin lift, but you're doing a jaw thrust.
All this is done by another person holding the stabilizing the neck,
Yeah.
and I'm simultaneously opening his jaw.
Yeah. If the person is unconscious and if they're not moving the neck, then you don't have to worry about holding the neck because he's unconscious. He won't be able to move the neck. It's more for a person who is in pain and is trying to move the neck. Okay, they need to be stabilized first. The other thing is, once, let's say if he's breathing enough, we should be able to do a triple immobilization. And someone asked me last time, if we can show this on a live person. And that's one of the main reasons we thought we'll get someone to to show it on a live person. So as you can see, ideally there needs to be a board below where you can actually slide a small board below the head. On both sides, you can keep something heavy, like it doesn't have to be this is a pre-made block for head injury, okay, but you can keep a small hard object on both sides, okay, of the neck, and then put a strap on top of the forehead, put a strap on the chin, and that is triple immobilization. Okay, and that means this will make sure that the person doesn't move his head. Perfect. Yeah. So the reason it's called triple immobilization is there's one on the forehead, one on the chin, and both sides of the head. It's blocked in 3 ways. Now, if you move this person in this manner, okay, to the hospital, it's very safe. You don't damage the person's neck unless you really move it hard. So this is a very safe way of transferring a person from one place to another. Okay, so this is airway with C-spine. Next, once this is sorted, then we go to breathing. Like we mentioned, we can't do much in breathing. All we can make sure that is he breathing enough is important. We need to make sure that is the chest moving enough. And if it's not moving, that's an urgent thing. We have to move the person to a hospital right away. Coming to C, circulation. The person might be bleeding from somewhere, but you can't stop all the bleeding inside the body, but you can stop the bleeding if the bleeding is happening outside, in the sense if it's pouring out of the body. Like if he's injured the leg, let's say there's a big bleed in the leg, do a compression. Immediately press with the cloth. Okay, what do we have? Just press it really hard for 10 minutes. Make sure he doesn't really lose any more blood. If the bleeding doesn't stop in 10 minutes, okay, and it just continues, it means that you need to put a tourniquet. So if the bleeding is on the thigh, let's say in the lower part of the thigh, you need to apply a tourniquet on the part of the thigh which is above that. So above the wound, to stop the blood flow to that part of the thigh. So as Dr. Vikas is demonstrating, you can see you put a really tight knot, okay, really tight knot, and you can use sometimes a small object like a pen or a small object like a small piece of stick or something. Usually put a knot on top of that. And all of this has been explained in detail in our previous classes. We are just showing it as a quick demo today, as a revision. You can always go back to your previous classes and see. So like you see, if you put a knot there on that object, now you rotate that object, it's easier to form, a tourniquet, much easier to create a pressure on that area rather than you trying to put a knot. So this way you can keep rotating it until you see the bleeding stop from that site. And that way you stop the bleeding at that leg. That is with C. And if it is a hand, if it's bleeding, if it's a fracture site, you can just stabilize the fracture with a stick. Again, we've explained this in detail in the previous classes. You can keep 2 sticks to stabilize, or you can just put a sling. Just bandage them. Or the main thing is you're not going to fix the fracture. All you need to do is to stop making it get worse from what it is already. So that's what we're trying to do. That's great, Dr. Vikas. So once C is complete, we go to D. D is disability, where we actually see the person's pupils. If in this person who has fallen off the bike, definitely has got head injury. Usually, if the bleeding, the brain increases to a very high level, and then if you see the eyes both sides, they'll be unequal. And we've explained this in the previous classes, where you can see the pupils are unequal on both sides, and that means something is going really wrong in the brain. Then we'll have to take the person to the hospital immediately. Okay. And the last part is E, exposure and explore. You just have to make sure there isn't any obvious bleeding you're missing anywhere else on the body. You've looked at the hand, you looked at the thigh. Sometimes it might be from the tummy or in the shoulders. Anyway, you just have to make sure there isn't anything else you're missing. Once you do a quick sweep, then just cover the person. Just cover the person with a blanket or with a cloth. Make sure they're kept warm. Okay, don't let them just lie on the road for a long time without being covered. That makes it, that makes their body cool down very quick. Once the body cools and they drop the temperature, is really bad for their blood circulation. Great, so that's perfect. And now the person is ready for a transfer. You can take, once the ambulance arrives, you've done your best, what you can before the ambulance arrives. And it's, this will be a perfect situation for transfer. Okay, so Jazakallah khair, Dr. Vikas and Dr. Naufal, thanks a lot for volunteering for this. And inshallah, we'll get back to you once. If people have some questions, they want to demonstrate something, we can always call you guys back in. Stay with us for the next few minutes. Jazakallah khair. Okay. Great. So, yeah, we have done with that. I just want to give a special thanks to Dr. Vikas, for really, organizing all of the sessions despite his heavy sort of work timings and schedule. He's taken all his time out despite his work schedule. Sometimes he's been working, and during the work he takes permission, comes and shows us this demo. Thanks a lot, Jazakallah khair. And also Dr. Nabil, who's been recording all of this. If you see the person who's been recording all of these videos, it's been Dr. Nabil, and really thankful to him. And Dr. Naufal, who's joined us today to be a patient, okay, and give us shows all this, help us through this demo session. Jazakallah khaira, and thanks a lot. So the next part is, I wanted to just highlight that, this is all the emergencies that we're talking about, okay, and we are trying to tell you what to do when an emergency happens, okay, but we also acknowledge equally that prevention is better than cure. So it's best that we always prevent all of these scenarios. We don't want any of these scenarios to happen to any of you, okay. And inshallah, we'll be releasing on a weekly basis, we'll be releasing few posters, okay, through either Instagram in Harikak or through other ways where we can continue to do this effort. We keep this effort on, where we actually post small posters highlighting these points and also some points of prevention, inshallah. Some resources, okay, I've not really cluttered with a lot of resources. All I wanted to show was 2 main resources. Okay, one is a first aid guide from St. John's Ambulance. It's a very concise and I wouldn't say concise, it's a detailed one. It's 300 pages, okay, but it has pretty much most of the first aid topics covered in it. Inshallah, I'll be sharing the PDF of this. This particular PDF is made for the public, and it's from 2019, so not too old. I'll be sharing this, inshallah, along with, when I share the PPT and the recording, we'll share the link for the slide as well, link for the PPT PDF as well. The second resource I wanted to show was, as Dr. Zishan mentioned previously in his talk as well, this is the NHS website, okay, nhs.uk/conditions, okay. This is for all the small things, and even small or big things. It could be as small as a febrile seizure, in the sense I'm saying for a child, okay, or a common cold, what to do when you have, fevers with COVID and other things. Every information, small issues, vomiting continuously, diarrhea, constipation, whatever topic you want to choose, you can always put your query on this search box here. And this has been done by the UK government, okay, for the public after a lot of research and a lot of opinions from different doctors, okay. So this is a very authentic site. Instead of Googling it, okay, every time you put a word in the Google, if you put diarrhea, chest pain and other things, it will always show you different results, okay. Each time you put it, it might come in a different manner. And you cannot trust every single Google result, okay, from whatever comes on the first search result. So the best thing is to go to a reliable website like this. You can go to NHS website and put what conditions you have questions regarding, and it will give you in a patient's perspective, on a person's perspective, simple English terms, will tell you what is it all about. As a final thing, before we go to the Q&A and before we go to the question answer and some the final closure, we have a special guest, okay, Abdullah Taha Madani, our brother Abdullah Taha Madani. Unfortunately, he's not able to join us today because this is his work time, so he's not able to join us. But he has very kindly offered us with his advice, and I would like to play his advice for us. I hope everybody can hear it. Dr. Zishan, are you there?
Yeah, I'm here, Nabil.
Okay, when I play the audio, if you just let me know if you can hear it, all right?
Yeah.
بسم الله الرحمن الرحيم الحمد لله رب العالمين وأصلي وأسلم على نبينا محمد رحمة للعالمين والسلام عليكم ورحمة الله وبركاته. In the beginning, I would like to thank Allah subhanahu wa ta'ala for making it possible for all of us to complete this beneficial course, and I ask Allah subhanahu wa ta'ala that He rewards the brothers who have given their time and put their effort to make this possible. May Allah subhanahu wa ta'ala reward them abundantly. From the Islamic perspective, saving lives is such a great deed because, as we all know, that one of the 5 necessities of our religion is the safety of the nafs, or saving the lives of the souls of the people. And the Sharia and all the rulings that we have came in order to achieve, or in order to protect, these 5 necessities, and one of it, as we have mentioned, is saving the nafs. So anything that harms the nafs, anything that harms the life, Islam came, or the rulings of Islam are into protecting the nafs and warding off anything that could harm the nafs in any way or any form. Also, if we happen to look towards the hudud, we have al-ain bil-ain. If someone happens to harm and damage a person's eye, his eye has to be damaged in a similar form. As-sinnu bis-sin. When a tooth is broken due to him harming the other person. All of these ahkam are in order to ward off the people and to protect. So this is how the deen protects a person, his life, his body, his nafs, his soul. And likewise, if we happen to save and protect a person from any form of harm, this is one of the greatest virtues in our deen. So saving life is a necessity, and saving life is a virtue. Allah says in the Holy Quran, whoever kills a soul unless for a soul or for corruption done in the land, it is as if he has slain mankind entirely. فَكَأَنَّمَا قَتَلَ النَّاسَ جَمِيعًا. And whoever saves one, it is as if he has saved mankind entirely. So we have 2 things here. If we happen to harm someone, it is as if you have caused harm to all of the mankind. And similarly, if you happen to protect the life and saved someone's life, it is as if you have saved the mankind in its entirety. So saving life is one of the greatest forms of virtues that we have in our deen. And saving people from harm in general, if not for life, if not if we don't have a person whose life is endangered, we may have situations where the people may lose one of their body parts, say for example, or it may cause harm to their health from burns, from cuts, etc. Anything or any emergencies that we have, anything could be possible. So if we happen to if we happen to be the cause of saving the people or giving them the first aid and rescuing them until they happen to get a proper medical assistance, this is something great, and this is what we have learned from from our doctors. May Allah bless them, and may Allah reward them abundantly. In addition to what we have mentioned, helping others is a great virtue in Islam. The Messenger of Allah sallallahu alaihi wasallam said, "The dearest of people to Allah may he be exalted is the one who does most benefit to people," which means that the best of the people are those who benefit others. And when we happen to save others from harm, and when we happen to save others' lives from any form of danger, this is one of the qualities by which you could become dearest to Allah subhanahu wa ta'ala. Ahabbun nasi ila Allah. And then the Prophet said, and the dearest of deeds to Allah, may he be exalted, is joy that you bring to a Muslim, or relieving him of distress, or paying off debt for him, or dispelling his hunger. And to walk with a brother to meet his needs is dearer to me than observing i'tikaf in this mosque, which is the mosque of the Prophet ﷺ in Medina, for 1 whole month. Subhanallah. So this is the virtue of helping others, and spending your time, spending your effort in order to help others. So this is just with regards to helping others. And imagine if you are helping others not just to have some work done or having them having their needs fulfilled, etc. Rather, if you happen to put your effort, put your time, put your resources in order to save their lives, save them from danger, save them from any form of harm, this is something that is truly praiseworthy, as well as a reason for being dearer to Allah subhanahu wa ta'ala, as mentioned in this hadith. So helping others is a great virtue in Islam. And let me add to this hadith that helping others has no limits. In fact, helping is not limited to the mankind. Abu Hurairah radiyallahu anhu narrated that the Prophet sallallahu alaihi wasallam said, "A man felt very thirsty while he was on the way. There he came across a well. He went down the well, quenched his thirst, and came back, or came out. Meanwhile, he saw a dog panting and licking mud because of excessive thirst. He said to himself, 'This dog is suffering from thirst as I did.' So he went down the well again and filled his shoe with water and watered it. Allah thanked him for that deed and forgave him." The people asked the Messenger of Allah sallallahu alaihi wasallam, "Is there a reward for us in serving the animals?" He replied, "Yes, there is a reward on account of every living being." This hadith is narrated in Sahih Bukhari. So look how the Prophet sallallahu alaihi wasallam has mentioned in this hadith that a person is offering water to a thirsty dog, and Allah subhanahu wa ta'ala is pleased with this deed, and he admits him into the Jannah by forgiving his deeds. And the Sahaba wanted to confirm when they asked, "Is there a reward in serving the animals?" The Prophet ﷺ said, "Yes, there is a reward on account of every living being." So when we happen to serve others, we won't see what is his background, what is his religion, what is his origin, what language does he speak, what is his nationality. We don't look at it. If there is a need of rescuing, or if there is a need of helping someone and protecting them from any form of danger, we just do it with the intention of seeking reward by Allah, from Allah subhanahu wa ta'ala. So this hadith shows us that this man helped this dog from dying out of thirst, and Allah subhanahu wa ta'ala admitted him or forgave him and forgave his sins, and therefore that would be a way for him to admit into the paradise. So this shows that there is a great virtue of helping others, and the toppest and the highest form of helping any living being is protecting his, her, or its life. And this is what we are able to do by these kind of courses and these kind of information that we have gained. We are capable of helping others in times of emergencies and in times of calamities. We ask Allah subhanahu wa ta'ala that He first, we intend to please Allah subhanahu wa ta'ala by learning this course, and we seek a reward from Him. We ask Allah subhanahu wa ta'ala that He rewards us for seeking this important form of knowledge, and we also ask Allah subhanahu wa ta'ala that He makes us beneficial for our brothers and sisters, and at the same time we ask Allah subhanahu wa ta'ala to protect us, our loved ones, and all the people from any form of harms, any forms of dangers, and may He never decree any such harm or danger for any one of us or any of the Muslims. Ameen. Wa jazakumullahu khairan. Wassalamu alaikum wa rahmatullahi wa barakatuh.
That was a beautiful advice from our brother Abdullah Taha Madani. We thank him for that, and we hope that we get more such advices and more such sessions from him as well. So moving on, I'm sure all of you are aware about the quiz that we've released so far. Okay, there have been few respondents, not great number. I would encourage all of you to actually appear for the quiz. The quiz is posted as an assignment in the Google Classroom for the people who are taking the diploma, and it's also been posted in the WhatsApp group for men. So I would encourage all of you to answer the quiz. The 10 questions only, not many. And inshallah, we will be sending out a video separate for the answers by December 15, inshallah. Right, let's get to the Q&A now. And I'll open the floor now for questions. You can ask questions based on anything so far we had in the course, and we'll answer, inshallah. So this would be an excellent opportunity to revise or to learn anything that you've not understood. So I have a question here. Dr. Zishan and Dr. Nudi, are you both here?
Oh, yes, Nabil, I'm here. And Z
okay. All right. Related to your talk, Dr. Zishan mentioned that we'll give 300 milligrams of aspirin to a person who is having a heart attack, and that's to prevent to make the clot get worse in the heart. That was the main purpose. So can we do something similar for stroke, and why we shouldn't, as a public, give 300 milligrams aspirin when someone's having a stroke?
Okay, so with regards to stroke, as I said, 80% can be a clot, and remaining 20% is a bleed in the brain. So without knowing what it is, if we give aspirin and if there is a bleed in the brain, it will worsen it. It will increase the chance of bleeding. So it's better not to give aspirin. So the main thing for stroke is if you take them to the hospital at the earliest, there are chances that they will give some medication, as mentioned, like thrombolysis, to reverse the clot once when the CT has been done. So the aspirin in the pre-hospital or at home is not recommended if you're suspecting a stroke.
Okay. Great. And there's one question for Dr. Zishan, that if a child has had a seizure at 3-month-old, okay, and they've been treated by the neurologist, and now the child doesn't have any more seizures at 3 years of age, do they still need to take the precautions of being close to the pool or when they're swimming, or other sort of normal activities? Do they still need to be taking precautions? This question is for Dr. Zishan. Dr. Sishan, are you available? I'll check if you're not muted. All right, I'm not able to hear anything from Dr. Zishan. That's all right. My advice would be on this that, if the symptoms have been resolved, they've not been having any seizures for a long time, especially when you're telling it's 3 months to 3 years of age, then I don't think we need to really do anything at the moment. That should be, you don't have to take so many precautions. That should be fine, I think. So moving on, there was a question on COVID. Again, people are asking about the foods like orange juice or coconut water and other things. So there's no, I don't think there's anything proven along with it. Okay, you can drink orange juice, you can take coconut water. All those are good. Okay, none of these should affect your COVID. Okay, so they're not usually related to any of your health conditions like COVID. So the other thing was about midazolam. Is Dr. Zishan back? I hope he's back. We're not able to hear you. Someone is asking about a nasal spray of midazolam. Can that be given to all ages of people? I think Dr. Zishan is trying to reach, trying to talk, but we're not really able to hear him.
Is he muted?
No, he's not muted. Doesn't show he's muted, but for some reason we're not able to hear you. I don't know.
Hello.
Yeah, we can hear you now.
Yeah.
Yeah. Okay. So is it clear now?
Yeah, it's clear. Yeah.
Okay. I don't know what happened. What was that question?
It's about midazolam. Can we use it for all ages? The spray.
It's usually given for kids. For older people, you will need a larger dose. For older people, we usually give them medicine when they come to the hospital. Theoretically, yes, it could work in older people, but you will need a much bigger dose. So they don't. I haven't seen them giving that spray. I think I think they do have it for older people, but it depends whether it's available or not in your pharmacy and hospital. Because based on that dose, they will give it for older people, and then you could give it. But again, it's given for those who have problems with seizures. Not everyone should buy, if you don't have anyone who has seizures at home.
Yeah. Perfect. There's a question on shock or stroke or accident. If a person has a pulse but is unconscious, what should we do? I think that's what we are trying to show, that if someone is unconscious, and you have to check if they have pulse or breathing. And if they're not breathing enough, we have to do a jaw thrust if it's an accident. If it is not, you can do a head tilt chin lift. And then we do the DRS ABCD. That's basically the protocol. Someone is asking about, should we put a person upside down? I'm not sure if I can quite understand the question. If he's drowned in a swimming pool. No, we don't do that. Dr. Zishan has explained in the last class about it, of what to do when someone is drowned in a swimming pool. I'm sure you get good information if you watch the 6th class. That's environmental emergencies and poisoning.
I think they mean to say if you put them upside down, the water will just come out. Actually, no. Our human body is not like a bottle. If you empty, it will come out. No, it won't happen like that. It will get absorbed in the lungs. So either you have to push it out of the lungs by giving breath or compression, or let them turn to the side so they themselves cough it out or vomit out. It will not come out by doing upside down.
Yeah.
There's a question for you, Nabil.
Yeah.
It's about COVID. So someone says that, I don't know if you have answered this. Somebody having COVID, their oxygen level is good, but they're having chest pain. Why is that?
Oh, yes. Yeah. There was, I forgot to answer that. Yeah. Like, I didn't want to go into details of it when I took the class. I mentioned that, like how Dr. Zishan mentioned that you can have blocked arteries in your heart and that causes heart attack. Same way, COVID can cause that. Okay, for COVID has a potential to cause clots. Okay, and that can either cause heart attack, giving you chest pain, or it can go into the lungs and block the arteries of the lungs and can give you chest pain. So that's why it's important that you go to the hospital when they have a chest pain to make sure they don't have a clot. If they have a clot, then they need to be treated for that. And we'll take the last question, inshallah. So we can we're approaching the end of it. So I think we will continue taking questions in the Google Classroom, but just because we're running short of time, I want to stop with this last question. They're asking about seizure. If they lose, do they lose senses of what's happening to them when they have seizure? Dr. Zishan, you can answer that.
Yes, most of the people will become unconscious if they have a seizure. Basically, seizure means that you lose consciousness of yourself and your body behaves erratically. So you cannot be conscious and have a seizure. Very few people have that kind of seizure, but that's minor seizure. If you have like a big seizure, you will become unconscious.
Okay. And can we show, Vikas, if you can come, we forgot to show the recovery position. Should we show them the recovery position? When after the seizure, what do you need to do when someone is seizing? If Dr. Vikas can come online, we can show them how to put a person on recovery position. That's something.
Yeah.
Yeah, you've shown it in the previous classes, but again, this is a revision. That's it. I'm going to stop my share. So if the person is lying flat, first of all, if you can go on your back, okay, if you're seizing, you can imagine someone is seizing at that manner. Okay, if someone's arms and legs are becoming stiff and they're seizing, okay, the person next to him can move him to the left or the right side. Yeah. So Dr. Awful is moving. You can just turn the patient to the left or the right side, okay, and bend the leg which is on the top, and keep the arms closed. So in this way, you're preventing the person from choking on the saliva.
The important thing is, please don't give anything in their hand or, hold the legs or anything like that. Let it go on. Don't try to interfere with the seizure. It comes down by itself.
Exactly. Yeah.
It's electric inactivity in, overactiveness in the brain. It will come down by itself. Leave them. Let them be free. If they have anything covering their face or mouth or neck, whatever, take it out. Let them become fine.
Yeah, that's perfect. Jazakallah khair, Dr. Vikas, Dr. Nawfal, Dr. Nabil, thanks a lot for coming again. And I think with that we'll finish, inshallah. What we wanted to intend was to show you the basics of emergency care, and I hope we have done that. I hope you've learned a lot over the last few weeks. So my final words would be to remain safe. Okay, to go over whatever we have showed you all. Okay, revise them, attend the quiz, and we are open always. Okay, through the classroom on the WhatsApp. You can always ask us questions. The diploma finishes only by Ramadan next year, so we still have a lot of time. You can always contact us, and we will be posting small posters and other things. And we'll continue our sessions in Doc Talk, inshallah, with some topics as and when we can. So Jazakallah khaira and Barakallah fikum. I'll let Dr. Zishan and others say a few words if they.
Nabil, I just wanted to add something.
Yep.
If you're fine with it, yeah. So just to let everyone know, I know how busy these doctors are. They work more than 12 to 15 hours per day. And when we came up with this topic that most of us do not know most of these first aid things, and they readily agreed. And after working more than 12 hours per day, and this is not like a normal job where you're just sitting in front of a computer and working. You're saving lives. You come back home and then you plan this, including Dr. Vikas, his team there. All of this was really wonderful. I mean, I haven't taken a course anywhere where all these live examples were shown, and most importantly, where everyone actually cared. Like all you doctors, you really wanted us to learn so that we actually go ahead and then save lives. It was not like any other course where you're just teaching it for the sake of it. So I know personally how busy you guys are and how much effort each one of you have put. So I'm very indebted, and sincerely thank each one of you for the time you spent in this course. And it was not a 1 or 2 weeks course, and really thankful to you. And I think it'll really help us It'll help us a lot. And just want to inform that in our coding course also, many sisters have been trying to create an app for the AED, and they have been really inspired by this course. They've been wanting to do many things, and they want to get in touch with you. So just trying to inform you about the ripple effect which is creating. So Jazakallah khair to all the doctors here.
وإياك barakallah fik. That's really nice of you. And wantum jazakumullah khaira for being the backbone of our Rikak. I would say that thanks a lot for hosting us and giving us a platform and helping us share our knowledge. We're always happy to come back and share more and help people. I'll let Zishan talk if he has any more words to say.
Yes, Nabil. Yes, that's what I mean. We have to give special thanks to Farhan for initiating a Rikak and coming up with these ideas, and for constantly pushing us to to do this. Sometimes we get tired and lazy, but he's always there behind us to motivate us. From my side, yeah, I mean, it was a good experience. Sometimes it was, we were tired. We didn't have enough time to make all this, but I think my intention was to make sure that people learn some basic first aid in managing illness. At least, even initially we had a lot of people, then the numbers came down, but I wasn't really worried about the numbers. I always felt, even if I remember telling Nabil, even if at least 10 or 20 people can learn this properly and they move on and they teach it to more people, that itself is a big benefit. So alhamdulillah, we have like 70, 80 people now, sincere people. So that is also a good number. And hopefully, inshallah, now that we have this thing, we can keep more. We have all the material. We know where we went wrong. We know what to do better next time. So we can keep this medical session again and again for people to benefit. Hopefully, if you're all in India, sometimes we can even do live sessions, inshallah. And this part is over, but we will continue on with other podcasts. We had come up with a Dog Talk podcast, but inshallah, we'll try to do that in future. Come up with each of these topics. We'll try and talk in detail next time. So hopefully that's a plan. Each topic that we spoke about now, in the next few months, we will take one topic and we'll have like a full 1 hour discussion, question answers on each topic. So everyone will be satisfied, because we couldn't give enough time for each one, but hopefully we will in the coming months give more in detail. Other than that, nothing much from my side. Yep. Thanks everyone. Thanks Nabil as well for helping. Yep. Inshallah, we'll meet again.
Barakallah fik. Yeah. And the one thing I forgot to mention is, thanks a lot thanks a lot Farhan for reminding that this is an ongoing process, and some of you have taken the task of creating apps and stuff. I'm really happy to hear that. Something like that, okay, you'll have to create solutions in different parts of the world, wherever you are, different cities, and we'll be happy to help you at any point. If you contact us with if you want specific details or information on how to do and what to do, how to learn, how to teach, we are very happy to help you. Okay, our doors are open for that all the time, and even if like Zishan mentioned, even if one person ends up saving one life, okay, through this course, and we'll be really happy. And then all the praise goes to Allah Azza wa Jal. So with that, I will end, I think. Subhanakallah bihamdika ashhadu an la ilaha illa anta astaghfiruka wa atubu ilayk.